I don't know if my slide is visible to everyone.
Yeah, that's perfect.
Beautiful.
Oh, okay.
Thank you.
Perfect. So thanks everyone. Thanks Francis for your presentation. And it was interesting learning those gender aspects of your study. Today I'll be presenting on behalf of I and my colleagues, and we're presenting gender roles in sourcing and sharing of banana planting materials in communities with and without Banana Bunchy Top Disease. This study was carried out in sometime in 2019, and we published the paper in 2020. And the idea of this paper was to look at the spread of Banana Bunchy Top Disease and its control. And we took out some time to look at the gender perspective of the study. So, and that's the foundation of this study. So we all know, like you pointed out, in sub-Saharan Africa, banana is a high income value crop. It's a major income for both households, small and large. Same thing with Nigeria. Banana is largely cultivated. And by banana, I also mean banana and plantain. So subsequently, I'll be using only banana for throughout the presentation. So both banana and plantain are highly cultivated. In terms of banana production, unlike my colleague pointed out, in Nigeria, the role men and women play in banana and the seed system varies largely. Now, this banana is affected by a very notorious disease, which is called the Banana Bunchy Top Disease. This disease has also increased the challenges that is being faced in banana production and its benefits. What is this disease about? Banana Bunchy Top Disease, if you are asking about. Banana Bunchy Top Disease is was recognized in Fuji Island sometime in the 20th century. And since then, it has spread to over 50 countries, including Asia, Australia, and several other countries. It has affected millions of small farm holders in sub-Saharan Africa, Nigeria, Cameroon, and the likes. In Nigeria, the disease was found out in 2012 in Ogun State local government, and then it spread to other areas of Nigeria. Now, I want to spend a few minutes to just explain this disease, how it spread, and how you can symptoms of the disease. So the name of the disease, Banana Bunchy Top Disease, is gotten from the symptoms of the disease. So when it affects a banana plant, the banana plant becomes stunted, and the top leaves, if you can see this slide towards my left, sorry, you see the banana. You see the banana being stunted and the top of the leaves being bunchy, like a bunch. So when it affects the plant, after some time, the banana turns like, even when it's very old and it doesn't grow more than this. And so that's why they call it Banana Bunchy Top Disease. So it's spread by a virus, and that virus is spread through an aphid pest. And that's one of the ways that it's spread. One of the things that's peculiar about it is that apart from this aphid spreading the disease, one major spread of the disease is the banana seed, which is like, because banana is spread by vegetative material, as in it's planted by vegetative material. So these seeds serve as large hosts, not only to this aphid pest, but also to the disease itself. And this planting material may look very healthy, but yet they are infected. So the infection may not affect the seeds, but when you plant the seeds, it greatly affects your production. I've already listed some of the symptoms in the last slide, and I just wanted to point out that it can lead to 100% loss in production. This is how the field looks like. There will not be fruits, and it keeps taking up the land. It will remain like this for continuously, and it's not going to produce any seed, so leading to severe loss. You may come to a field that looks very beautiful and fine, but when you go in, there are no fruits after several months of planting or years of planting. Now, what are the gender aspects of managing this disease? Because we realize that in control of disease in the production and every aspect of banana production, there are men and women aspects. However, there are gender issues that have to do with management of banana bunchy top disease. One of the things we observe is that there was need to look at gender consideration for in seed systems. So how seeds are spread between men and women differ across zones. So it means that men and women assess seed differently. So if we're able to control how seeds are assessed and passed from one person to another, we're able to control the disease. Remember I said that this disease is spread by the seed, which is this vegetative materials. Also, men and women face different opportunities in access to production and seed. And so we try to look at these issues. So what was the purpose of our study? The purpose of this study was to understand the gender dimension of and sociocultural aspect of seed sharing and sourcing among men and women, female farmers. Also, we want to look at how we can incorporate gender strategies for the control of BBTD in Nigeria. So where was this study located? The study was done in Nigeria. We picked a BBTD zone and a non-BBTD zone. So we looked at some of the local government with high banana production and compare them with the low, their government that had high banana production, but they were BBTD free. And these are the local governments area. These are the communities we selected. So we also worked with, we used both qualitative and quantitative method. We interviewed 300 farmers, 187 men and 113 women. We looked at seed producers, those both commercial and local seed producers. We did our FGD, interviewed key informants, and also direct observation on the farm. What are the findings from this result? And now there are a series of findings, but I want to focus on those that are germane to the spread of BBTD. Now, if you look at this chart closely, we are looking at how people source these seeds. And in terms of seed sourcing, the blue chart here, it shows that majority of people use source seed through friends or relatives. And relatives means like in the communities, people live with their uncles, their aunties, their cousins. So they usually collect seed one from another. But interestingly, when you look at the men, you see that the men in this gray area take more seed from old fields as compared to women who rely more on relatives. So women will get their seed more from their husbands, their relatives, but men from old fields. So because men actually deal with things like inheritance, men are the one who they pass on family inheritance, so they inherit their father's land or previous banana plantations from their parents, and they from these old plantations they're able to transfer to new plantations. Also, men are able to go further into the forest to go and get land to cultivate, as compared to women who are limited to farming within the household. Women usually travel less distance in terms of trying to look for seed. So that suggested to us that in terms of controlling of banana seeds, when we are looking at inter-community control, we need to focus more on women. But in terms of intra-community, we needed to focus on men, because intra-community was more spread by men, while inter-community spread of the disease was carried out more by women, because women dealt more with seed transfer within the community, within localities, by relatives. Now, in terms of the constraints, the core problem in banana seed sourcing was access to poor banana seed system. So that means that farmers didn't have access to the best of seeds that were free of disease. And we looked at the effect and what are the root causes. So this is like a problem tree. So the stem of it is banana poor seed system, and these were due to unavailability of large quality seed, high transport costs, disease, poor transport network, long distance. And this in total led to late planting, increase in cost of production, health stress, preferred planting less preferred seed, and less time for household and farm activities because of the poor seed system. So if we're able to control the seed system in Nigeria, we're able to limit the spread of disease. What are some key results and other implications? We also observed that men and women had limited knowledge on BBTD as they mistook this disease as young suckers, and so they were replanting them. People are unable to identify this disease, are able to identify disease-infected seeds. Both men and women cultivated farm size more planting material in the BBTD area. So we observed that the disease has eaten up production. So people began to realize that they were making less and less money from banana. Hence, they started to cultivate fewer hectares of banana because of lower productivity. Women also had lower time for farm activities due to household duties. And we looked at that during the FGD, women indicated that banana production groups are a better way of extension. So women usually had extension services access to them, but women had few access to extension. So we looked at the fact that to encourage knowledge sharing among women, then they prefer to be met in groups for banana production education as compared to men. And we also need to raise awareness of the spread of disease within the community. Other implications of the results was that men and women farmers should be targeted for intervention. So, and the intervention should be separated. We thought that during the FGD, people spoke differently when you had men and women in different groups. So in terms of education or target for interventions, there was need to target these men and women differently. And we also suggested that containment of the disease, there should be a community approach because this disease spread within communities. So there's a need to target communities. This community may have some norms that are peculiar to them, and these norms have to be addressed peculiarly based on each community. Concluding, we realized that raising awareness of the disease will help improve the control of the disease, and this should be gender-based, should be differentiated within the communities. We also realized that a reliable seed clean system accessible to both men and women is crucial for sustainable management of the disease within the community. We also advise that research agents and anyone who wants to involve in disease control, especially as regards banana, should explore an interdisciplinary approach. By that, I mean that you work with both extension agents, farmers, those who are producers, and different stakeholders who are involved in the banana value chain to help limit this disease. Also, farmer-to-farmer network through strict regulation can control because disease are spread by people sharing seeds. So there was a need to look at farmer-to-farmer network through strict regulation in the movement of planting materials. If we're able to help farmers to reduce spreading this disease by sharing infected seeds, we will cut down the spread of BBTD by a large percentage. Also, we encourage strategic partnership through collaboration within the community, regional, and global levels. Thank you so much for your time. And this was just me taking some information from the farmers during our FGD. I'll take a few questions.
Thank you so much, Favour, for that really interesting presentation on how men and women farmers are involved in banana bunchy top disease management. Some interesting points there on gender issues in disease and pest control. So a question here, what factors did you consider to assess the role of gender in banana bunchy top disease management?
So the factors I looked at was that, first of all, we looked at the production system. How is banana cultivated in the communities? We realized that men and women cultivated the crop. Two, that men and women, I said, the main seed is the main way which disease is spread, and men and women assess this seed differently. Like I saw in my chart, women took this seed more within the communities from their relatives, while men assess this seed either by purchasing. Sometimes they went to old fields and harvested their suckers for the new plant, for the new farmland. So that suggested that there were different approaches to in terms of investigating how disease is spread. So that suggested that we needed to look at a gender approach for the control of banana bunchy top disease in our research.
Another question here from Wilma. Is there any farmer field school in the country, as they can apply it also to banana disease management? I think this is the best way to educate the farmers on the banana problems.
Yeah, extension system is largely comatose or not as effective as it wanted to be in Nigeria. So we have sometimes people, extension agents who go to the fields once in a while to educate these farmers. But sometimes in the very rare area, you have farmers having an extension agent who come there once in a month, once in 3 months, and are not able to reach out to the farmers. So pharmacy system is not as effective as we want it to be. And that's why we are also calling for interdisciplinary approach to these things. So in terms of communication, which is not part of this publication here, we looked at how people prefer to be reached. Men preferred just people reaching them by radio, flyers, educating them, while some women also preferred them having group discussion about this. So what we have done is to use the multiple system of communication. So we had jingles in local dialect about Banana Bunchy Top Disease, its control, awareness. We also distributed flyers on the spread of disease. We also spoke to their ballet, that's their king, on how to educate them during community meetings. So, and their farmers leaders association to also educate them. So trying to explore multi-approach to the control of the disease.
That's really interesting. Yeah, definitely. One last question. Can we do ELISA, that's ELISA, to identify before planting?
Yes, we can. I guess by ELISA you mean the viral identification of these things in the lab. That's possible. We've done it in the Research Institute IITA, and we keep doing it. We are one of the people that produce viral cleaned seeds and distribute to the farmers. But one thing you acknowledge is that farmers are not able to do this ELISA treatment themselves without unable to do this kind of treatment themselves in the rural area. So you have to let them know that they need to take clean seeds from research institutes and the likes. But many times, some of them, they still prefer their old variety, or they prefer what they are used to. They feel like this one is okay. I've been using it for several. My father have used it. My grandfather have used it. Why do you want me to take your own clean seed? So why that is what we are doing as a research institute, to kind of give them clean seeds. We must also realize that rural areas or rural farmers do not have access to that high technology for that control at the rural level.